Skin cancer is very prevalent in the Australian community, and I think the latest Cancer Council statistics say that 2 in 3 Australians will have some form of skin cancer by the age of 70. So it's more prevalent than we think. Some patients are increased risk of developing skin cancers, and typically the patients who is at most risk are those with fair skin, blue eyes or red hair, who burn easily. Because skin lesions or skin spots are so common, there are a few good general rules to follow. What I tell my patients is that anything that doesn't disappear after a couple of months, anything that's painful, bleeding, itchy, just doesn't look right, it's often a very good idea to get it checked up by either your local doctor or your dermatologist or a plastic surgeon as well, just to see whether a biopsy or at least some reassurance is needed. Then there are lesions or pre-existing moles that one has growing throughout life. There's an ABCDE rule that's often taught or talked about. A stands for asymmetry. Any mole that's become asymmetrical is something that needs to be looked at. B stands for border, and any mole with an irregular border again is something that needs to be looked at. C is for color, and that means various shades, or more than generally 2 or 3 shades of brown. We begin to start getting a bit suspicious. D is for diameter. Any mole that's increased in size or certainly bigger than half a centimeter is worthwhile having checked out, and certainly if it's getting bigger. E is for evolving, so again, changing or elevation, a mole that's become raised. So the ABCDE rule is a good rule just to keep in the back of your mind to see whether a mole needs to get checked out or not. I'm involved in all aspects of work in skin cancer treatment, starting off from diagnosis to treatment to follow up in certain cases. If a medical colleague or a patient is worried about a spot, I would be involved in examining the spot and determining whether a biopsy is needed or perhaps just a bit of reassurance. Typically, as a plastic surgeon, I get referred more skin cancers in cosmetically sensitive areas, or large ones requiring some form of reconstruction. Generally speaking, happy to be involved in any case, be it small or large, or whether it be just to provide some reassurance. And the best way to protect ourselves is early detection, because early detection of skin cancers often translates to smaller skin cancers, which would be more easily or more simply managed, say, in the rooms. Things become more complex when they grow large or they involve important structures such as nerves and nerves in the head and neck area. Moving forward, however, one of the best ways to help prevent skin cancer is avoiding excessive sun exposure, because we know that exposure to UVB radiation is one of the main risk factors nowadays of developing skin cancers, certainly for basal cell cancers as well as squamous cell carcinomas. And again, the old saying of slip on some sunscreen, ideally some SVPHM 50 sunscreen, seeking shade where appropriate, slapping on a hat, and wearing long sleeves, again, just to minimize the exposure to the sun, and again, minimizing your exposure to when the sun is at its peak, if you like. Those are all ways we could help prevent development of new skin cancers. The general advice or the safe message is, if you're ever worried about a spot, is just to seek some medical advice, either from your GP, your dermatologist, or plastic surgeon. We would be more than happy to have a look and hopefully provide some reassurance or take the necessary steps to treat it.